The main difference between complementary and alternative medicine compared to conventional medicine is that in conventional medicine we have a very high level of scientific evidence to support the therapies that are being used. Often that's not the case with complementary and alternative therapies. Oftentimes the literature for supporting those therapies are merely case studies or, in many instances, testimonials from patients. When you look at complementary therapies, that's usually something that's in addition to the therapy that we would conventionally provide. And when you look at alternative therapy, it's something that's used in place of what we conventionally use in medical practice. Mainstream evidence-based treatments should always be their priority. Once the conventional therapies have not been effective, or if the patient refuses conventional therapy because they want alternative therapy, then the physician could provide that to the patient. According to the Health Professions Act, we cannot take action against a physician for practicing complementary and alternative medicine, provided the physician does so in a way that it doesn't create any increased risk to the patients than conventional therapy, or that it doesn't cause harm to patients. Ultimately, it's up to the patient to decide what therapy they want, and oftentimes patients go to physicians that provide this type of therapy because they're interested in that different approach than conventional medicine takes. Well, the college expects the exact same thing a physician providing complementary or alternative therapies as they would a physician providing conventional medicine. It is our expectation that if they do provide it, they do have the skills and knowledge. If a complaint would come from a patient about a physician providing it, certainly we'd look carefully at what training they had to provide that therapy. The patient has to be well informed before they can consent to alternative therapy. The physician themselves must know the risks of it, whether there's any benefit, whether there's any evidence to support it as being effective, and be able to give that information to the patient. The other thing that the physician needs to keep in mind when they're providing alternative or complementary therapy is the ability of the patient to pay for it. Many of these therapies are not covered by the medical services plan, and therefore they're cost directly to the patient. They must follow the patient through the course of the treatment to see whether the treatment is effective or not effective, and depending on that, alter the course of treatment.